major points about the Canadian healthcare system. First, it is possible to provide medical care for everyone and still pay far less than the United States does. Second, a national solution does not have to start out on the national level. In Canada, children grow up with the story of little Tommy Douglas, who, injured in a football game, required surgery. His family could not afford it, and he was doomed to a life on crutches. Fortunately for Tommy, an orthopedic professor lived nearby and decided to demonstrate a surgical procedure using him. It was a complete success, and Tommy was able to walk normally again. Many years later, in 1944, little Tommy was elected Premier of Saskatchewan. And by 1947, he was able to set up a provincial insurance plan. Hospital care became free for every resident of Saskatchewan. Having won his fifth election in 1960, in 1961, Douglas was instrumental in setting up a system called Medicare. It served as a model for LBJ's Medicare, and it became very popular throughout the country. By 1964, a bill to establish Saskatchewan-style health care on a national basis passed both houses of Parliament. When in 2004, the CBC polled the nation to choose the greatest Canadian of all time, Douglas won by landslide. He beat out both Alexander Graham Bell and Wayne Gretzky. This poll has continued on a yearly basis since, with the same result. Canada's plan is based on the following 5 points. 1, in each province it is operated by a public entity on a not-for-profit basis. In each province, all medically necessary services must be covered. In each province, every resident has the same access as everybody else. The plan is portable and covers its members anywhere in the country, employed or unemployed. And 5, doctors must treat everyone for the same fee, regardless of age or illness. Canadians are largely satisfied, for no Canadian dies because she does not have access to a doctor, and no Canadian goes bankrupt for medical bills. As a result, as we've shown you, Canada has better health statistics overall than the U.S., including a longer healthy life expectancy and a lower infant mortality rate. Canada's universal system results in savings because of price negotiations. Drugs, for example, cost 1/4 to 1/2 less than they do in the U.S. There are, however, significant drawbacks to the plan. Possibly because of cutting back on costs. At one point, Canada cut back on the number of medical students, and the country does not have enough physicians. This has led to a waiting period problem. Of course, this does not include emergencies, and it varies from province to province and according to treatment. The reports that Canadians are dashing off to the U.S. to pay for their care, despite Thelma and Louise, no, not Thelma and Louise, who I've forgotten, the campaign during the Clinton effort for health care. Despite that, does anyone remember?
Harry Louise.
Yes. According to those who need care urgently, can get it in Canada, and those who can wait. Canadians are somewhat mollified as long as the rich Canadian and the poor Canadian have to wait about the same time. While most medical costs in Canada are covered by the government plan, roughly 2 out of 3 working people have private plans to pay for what is not covered. This includes dental care, private hospital rooms, prescriptions, and childbirth classes, among other things. But private insurance will not get you to the head of the line. It will allow you to buy things the public plan doesn't offer. Since these supplemental private plans do not have to pay the big bills, they are cheap. Often employers offer them as free fringe benefits. Nevertheless, Canadians remain frustrated with doctor shortages and waiting lists. And in today's world of new and more diverse delivery systems, it focuses too narrowly on hospitals and physician care, as has our system before the ACA. Like other healthcare plans around the world, it must seek and follow a new direction, one committed to improving access, quality, and efficiency. Optimistically, Reed quotes one of Tony Douglas's famous predictions: if people see that we can provide health care to all, free to any person, rich or poor, can get the medical treatment she needs, if people elsewhere see that, they will want it too. And they do.
Our good friend David Spencer was unable to be here this morning, and I'm honored to share his words with you. He's a very special man. 43 years ago, I found my way to the bank of the Yakima River in Washington State to check on Harry, a farm worker from Oklahoma living in his car with his wife and 2 kids. I was working at one of the first federally funded rural and migrant health centers in the country. My wife Heidi was teaching teachers how to teach English through ethnic songs and was helping with the initiation of the Farm Workers Family Health Center in the little town of Topanish, I think it is, Washington. These were exciting years. It was a time of hope and yet of despair. Of hope because of the Peace Corps, community action programs, community and rural health centers, women and infant feeding programs, and others aimed at raising the poor out of poverty and of assuring health care as a human right. But it was also a time of despair as we were losing lives in an unpopular and tragic war in Vietnam. Having served with the Peace Corps in the late 1960s, Heidi and I joined in helping migrant farm workers in the Yakima Valley of Washington State. It was a time of activism and change. Cesar Chavez's impact was enormous, not only on the lives of farm workers. His messages were global in reach, spiritual in substance, and powerfully inspiring, not only at the time, but for all time. And he said, when we are really honest with ourselves, we must admit our lives are all that really belong to us. So it is how we use our lives that determines the kind of men we are. This is still a call to action, not just words. Looking back 60 years, we see the birth of Medicare in this country. Following years of discordant political battles, Medicare finally became law on July 30th, 1965. At the signing, President Johnson said, "The need for this action is plain. We marvel not simply at the passage of this bill, but that it took so many years to pass." Now, 60 years later, we must ask, why is it taking so long to extend Medicare to the entire population? Over these many years, we have created costly and discriminatory systems based upon a staggering number of criteria for coverage. As a doctor, I have seen that chaos close up. Even with Obamacare, we see the insurance companies as the winners and our families as the losers, with millions still struggling with costs and access to care. These are moral issues. The chaos of political fighting obscures the clear moral truths. I want to share some brief quotes. Rabbi Alexander Schindler, past president of the Union of American Hebrew Congregations, said, "Health is not a luxury, nor should it be the sole possession of a privileged few. By pricing out a population of this country's population from health care coverage, we mock the image of God and we destroy the vessels of God's work." Imam Sadullah Khan of the Islamic Center of Southern California said, "The right of every individual to adequate health care flows from the sanctity of human life, and that dignity belongs to all human beings." And the Reverend Martin Luther King stated, "Of all forms of inequality, injustice in health care is the most shocking and inhumane." The media are filled with accusations and finger-pointing about Obamacare. Who is at fault? In reality, we all share in the blame. We fail to realize that these partisan political fights are ignoring the urgent human need for health care. This is especially true if we are among those who are well insured. We tend to sit on our inertia, saying it's not my problem. Anton Chekhov, in his story Gooseberry, said, "The happy man is at ease only because the unhappy ones bear their burdens in silence." There are still good people living in shelters and cars, not just migrant farm workers. We hear regularly the suicides and homicides attributable to the lack of access of mental health care, which has suffered major cutbacks. And I'm going to interject here. I work in a community mental health center in Westbrook. Last week, 3 people attempted suicide, and a 4th one was successful in ending his life. It's very real to people like me. Disparities in income and housing have become worse. Disparities in health care abound among us all, not just with the poor and the homeless. We must stop our divisive and destructive practice of deciding who will get health care. We need to move beyond the old concept of entitlement programs for care. We are all entitled to care. Anything less is inhumane. Yes, I know that hope will always battle it out with despair, but denial must not block our seeing clearly the cruelty of our current system. We can solve this one. We must act as one family, guided by ancient and universal moral principles of caring for each other.
Good morning. I'm not Bill Larson, but I'll do my best to say things since she's done yeoman work this morning. Our final words today come from the United Conference of Catholic Bishops in 2003. Healthcare is more than a commodity. It is a basic human right, an essential safeguard of human life and dignity. We believe our people's healthcare should not depend on where we work, how much their parents earn, or where they live. Our constant teaching that each human life must be protected and human dignity promoted leads us to insist that all people have a right to health care. Thank you.